Congratulations on the birth of your new baby. In this video today we'll be going over some of the basic needs of postpartum care and what you can expect in the weeks to come. Also, we'll be discussing some of the things you can call your doctor for should they come up. Please be sure that you read the information provided in your blue folder for any more detailed instructions. The cramping that you're experiencing right now is actually contractions, and it's shrinking your uterus back down to the size it was before you were pregnant. The discomfort only usually lasts a few days and can be relieved by taking over-the-counter pain medicines such as ibuprofen or Tylenol and use of heating pads. Your bleeding should decrease over the next few days and become lighter. Any increase in bleeding that you might experience or heavy blood clots about the size of your hand was definitely something you should tell your doctor about. Also, any foul-smelling discharge is not normal and might indicate an infection. Good hand washing before and after you go to the bathroom is the best way to prevent infection. If you've had a tear or an episiotomy with the delivery of your baby, you may need to take a few extra measures to take care of your perineum. For pain management, you can stick with over-the-counter pain medicines like ibuprofen and Tylenol. Ice packs may also be very helpful to decrease the swelling that you may have and also provide some pain relief. A sitz bath with warm or cool water can also help with some comfort. Your nurse will help to show you how to use this if needed. Right now I'll show you how to build a pad, so to speak, when you're in the bathroom. After you've gone to the bathroom, go ahead and use your peri bottle, open it up, and squirt a little water front to back as much as you feel like you need. Then afterwards, you want to take your pad. If you have any swelling or if you're still having pain, you may want to go ahead and open up one of these ice packs and lay them on top of your pad. After doing that, go ahead and spray your perineum off with the Dermoplast if you have that provided. You may also want to use some of the foam if you've had an episiotomy or a tear. If you're having hemorrhoids that are still painful, you can either use the cream, you can use the foam, or the Tucks pads, or you can use all three. To go ahead and do hemorrhoid care, you want to go ahead and put your Tucks pads with your cream on it, directly insert the cream, and put this exactly up on your hemorrhoid. If you're having problems doing this, you can also put it on the pad, but it is best to directly place it on the hemorrhoid. Go ahead and put the whole pad up against your bottom and then go ahead and pull your panties up to have it all hold up. It is a little difficult to do, but you're not going to have to do this forever, just for the first few days, as long as your pain lasts. With hemorrhoid care also, you may choose to continue to take your stool softeners that you were taking here in the hospital, and the important thing is to stay off your bottom and not strain. It's very important, again, to use good hand washing anytime you touch your incision. You want to make sure that you look at your incision daily to make sure that there's no bruising, no bleeding, no opening, or any kind of drainage coming from your incision. If any bleeding or bruising is noted, you want to make sure you contact your doctor. You may shower like normal and just use water to run over your incision as long as your hands are clean. You want to make sure that you don't put anything on your incision either. The most important thing you can do is leave it dry and open to air. You'll most likely notice some changes in your bathroom patterns after you just had your baby. If you notice any signs and symptoms of a urinary tract infection, such as frequency, urgency, or burning when you urinate, your doctor needs to know about it. With having a bowel movement, the baby can kind of slow things up as far as that goes. If you notice that it's been more than 5 days for you to have a bowel movement, you need to let your doctor know about that as well. If constipation becomes an issue, you can continue to take your stool softeners that you've been taking at the hospital and make sure that you take plenty of fluids in and also consume a diet high in protein and rich in fruits and vegetables. This will help you maintain a good digestive system, and it will also help your body recover after having childbirth. You need to also make sure that you take your prenatal vitamins if you're nursing. Your body is programmed to make milk after the delivery of your baby, and this is going to happen whether you're breastfeeding or bottle feeding. Your breasts will become mildly to moderately engorged within 3 to 5 days after having your baby. If you're nursing, it's important that you nurse very frequently, at least every 2 to 3 hours, to ensure adequate milk supply. If you're not nursing, it's important that you wear a bra, like a sports bra or something very snug fitting, for about 7 to 10 days. This is to help keep your breast supported and just decrease the milk supply that's going to happen in any way. Remember that you're trying to decrease the stimulation to your milk. You want to keep your bra on at all times. Only remove it to get in the shower. And remember to not touch your breasts any more than absolutely necessary. Whether you are nursing or not, milk coming in is usually not a very comfortable experience. The ice packs and over-the-counter pain medicines such as ibuprofen or Tylenol work great to help with that discomfort. If you're nursing, please make sure that you go over the written information from lactation and in your discharge instruction folder to go over more information on engorgement and nipple care. Please make sure you call your doctor if you notice any kind of red streaking on your breast or pain that's not cured by over-the-counter pain medicine and ice packs. After delivery, you may take a shower or a tub bath like normal. Whenever you're in the bathroom, after you finish going, you want to make sure that you use your peri bottle front to back for good hygiene. With activity after delivery, you may find that you get more tired than you normally would. Your body's recovering, don't forget. You want to make sure that you rest as much as you possibly can. We recommend that you don't do any heavy housework like vacuuming, sweeping, or mopping, and you just limit your activities to mainly taking care of your basic needs and your babies for most of the day. Try to delegate any kind of household chores or cooking to family members or friends that want to help you. We ask that you not drive for about 2 weeks. Also, no heavy lifting, including other children, for about 2 weeks as well. This puts added strain on your perineum and your incision, so we ask you to refrain from that. Complete pelvic rest is necessary for about 4 to 6 weeks postpartum. This includes no tampon use, no douching, and no sexual intercourse. Your cervix is still trying to close up, and it takes about a month for that to complete. At your follow-up appointment, your doctor will discuss birth control options with you. Your body is healing from not only childbirth, but possibly major surgery if you've had a C-section. You want to make sure you rest and sleep as much as you possibly can. Best way to do this is take naps whenever your baby takes naps. Your hormones are also going through major changes too, as your body's getting used to not being pregnant again. This can take a toll on your emotions as well. Mood swings are actually normal right now, and as a new parent, you're most likely going to experience a little bit of alteration in your sleep patterns. Failing to rest or sleep when your baby is sleeping can put you on a fast track for postpartum blues and depression. You want to make sure you ask help from others so you can primarily focus on taking care of yourself and your baby, because you both are learning to adjust to your new lives together. If you feel like your blues or depression is lasting more than a few days or a week, or you feel like your symptoms are getting worse, please call your doctor. They will take you seriously about this, and this can get worse if left untreated. You can also call our nurses up at the desk at any time, and you can find our phone number in your discharge instruction sheet. In this video today, we'll be discussing some of the basic needs of everyday care for the baby, provide a few demonstrations, and go over some things you need to call your doctor for. Please be sure to read the printed information provided to you in that blue folder that your nurses gave you. Babies need to be checked and changed a few times a day, especially before feedings. Normal output for a baby differs based upon what the baby's eating. The baby's nursing will probably have about 6 to 8 wet diapers a day and probably have at least 3 stools daily. Bottle-fed babies differ. They still have the same amount of urine output, but stooling could be multiple times a day, once a day, or they may even skip some days. If you notice that your baby has gone at least 2 days without a stool, you need to make sure you contact your pediatrician before you try to do anything to correct that. Okay, we'll go ahead and do a diaper change on this little guy right here. Okay, just take your wipe, go ahead and soak it in some warm water. That's all you need. And go ahead and wipe front to back. With little boys, you want to make sure you lift under their scrotum. And wipe their bottom really good. Okay. This little boy has a circumcision, so we'll go over some circ care real quick. This kind of circumcision is called a plastibell. He's got a little plastic rim around his penis, and it usually falls off in about 7 to 10 days. There's nothing you need to do for it except just examine it daily, make sure it's not bleeding, doesn't have any kind of discoloration, no pus-like drainage around it, and you want to make sure that he's going to the bathroom regularly. To clean it, you want to just go ahead and just like with the regular diaper change, just squeeze a little bit of warm water over it. You don't want to directly touch the head of the penis. There's nothing else that you need to put on his diaper, or nothing you need to put directly on the penis. Just squeeze a little bit of warm water and just blot dry all around. And he'll fuss and cry, but babies do that even if they're not circumcised, so don't think you're hurting them. Go ahead and apply another diaper. And that's about all you have to do. With the circumcision of the other kind, the Gomco or the Mogen clamp, you can just take your regular diaper and just put a little bit of Vaseline on it. It's kind of hard to directly put Vaseline to the head of a baby's penis, especially if they're squirming all over the place. So just take a big old hunk of Vaseline, put it all over your diaper around where you think his penis is going to be, and then just apply it like regular. If your baby has had no output or decreased output in a few days, or if you are having any problems with diarrhea, which for babies is mostly watery stools, you need to go ahead and let your doctors know before you try to do anything to correct that. Normal consistency of baby stool is very loose. If you do notice any watery stools, that would be more indicative of diarrhea, and that's something you should let your doctor know about. Changing a diaper on a girl, it's important that you wipe front to back. Make sure you clean down in between the labia as well. A lot of babies stay spitty for sometimes weeks or even months after they're born, so we provide you with one of these bulb syringes while you're here at the hospital, and we'll show you how to use that really quick. If the baby's ever bubbling at the mouth or ever getting kind of gaggy or spitty on you, just want to go ahead and squeeze it and insert it in the mouth. I'll let you let go of your passy real quick. Gently insert it inside of the mouth, and then remove whatever kind of mucus or whatever he's spitting at. Okay. Very good to have one of these close by at all times, in the crib, the car seat, in the diaper bag, because you don't ever want to need it and not be able to have it. Just like I showed you, just do a little gentle squeeze right here and then release. This, you really don't want to have to put it in their nose more than absolutely possible, because that's how babies breathe. And as you can see, just little teeny tiny nose holes, so the more you put up in there, the more you can cause inflammation, and it can make it very difficult for them to breathe. If you just have something blocking his airway, then you would have to use it, but if it's just a little bit of mucus or something in the way, you can try wiping it. It's a lot easier for him. For giving your baby a bath, it's important to make sure you do a sponge bath for about the first 2 to 3 weeks, or however long it takes for the cord to fall off. You want to make sure that your area is free from drafts. You want to make sure you hold your baby at all times, because when they're wet, they are very slippery. Start off with a little pan of water, and you want to test it with your forearm to make sure it's not too hot. And we're just right, so we'll go ahead and get started. For the first month, all the baby needs is just a little bit of water to wash off with. Soap and lotions are actually very irritating for the baby for the first month, so we don't recommend their use until afterwards. Just use a little bit of water only on the face. When you're cleaning her ears, just kind of bunch the washcloth up and just kind of scoop in it. And the same with the other side. And make sure you get the bottom of her neck really good. Oh, little girl. Okay. Dry her off and go ahead and start with the rest of her body. You want to make sure that you do it really quick, because they do get fussy. They can also get cold really quick too. Make sure you go ahead and do her diaper area last. And with girls, you want to wipe front to back. And with boys, especially if they have a big scrotum, make sure you lift it up to clean up underneath. There we go. We'll wrap her up and we'll go ahead and wash that hair. There you go, little girl. Okay. Now we're going to wash her hair since her body's all nice and clean. Just put a little bit of water. Since her hair is so long, we're going to use a teeny bit of soap, but for most babies, all you need is just warm water. Okay. After a baby's about a month old, you can use some regular soap, this or something similar. Baby skin is very sensitive, so you really want to limit their exposure to anything such as soap, lotion, anything like that for the first few months. We're putting a little bit of soap on her hair because it will get greasy just like ours, and you will have to wash it, at least once a week with soap. It's okay, little girl. Shh, shh, shh. All right, let's get you cleaned off. Whenever you are washing her hair, you want to make sure you fold her ears over like this so water won't get in it. Like we mentioned before, baby skin is very sensitive, so we are trying to limit their exposure to things. Soap and lotion are usually given after about a month of age, also in small amounts. You can also use commercial wet wipes then as well. Here, baby powder is not recommended at all. Okay. You can use Vaseline for diaper rash and for dry skin. For feeding your baby, times differ if you're breast or bottle feeding. Breastfed babies typically need to be fed about every 2 to 3 hours for the first few weeks. Bottle-fed babies about every 3 to 4 hours. There are 3 different kinds of formula. We have 2 here. The ready-to-feed, which you've probably seen if you're bottle feeding, the powder, and then the concentrate, which isn't shown, that you have to add water to as well as the powder. With the ready-to-feed, all you have to do is either pour this into a bottle or put a nipple on it and it's ready to go. When you're preparing your powder formula bottle, you want to go ahead and measure out the amount of water that you're going to use. And you can't use just any water. You have to use distilled water or the nursery water that they sell at the stores. We're going to make a 2-ounce bottle right now. So we'll need exactly 2 ounces of water. And we'll need 1 level scoop of formula. And make sure you level it off so you're not getting too much or too little. Put your scoop in the bottle. Put your top back on and you have to shake it very, very well to make sure everything mixes up correctly. There's no clumps in there. Now you have exactly 2 ounces of formula to feed your baby. The amount of formula you feed your baby will vary and it will probably change often as well. If your baby is wanting to eat a little bit earlier than an hour before it's time to feed her or him, it's a good sign that they probably need to eat a little bit more. You can always increase the feeding that you give your baby by about a ½ ounce every feeding until you know she's satisfied. Make sure you burp your baby very often, otherwise you might have a mess on yourself. Remember, all that your baby needs for nourishment at this time is breast milk or formula. Your doctor will let you know when it's time to introduce water, juice, or any kind of strained baby food. You don't ever want to switch the formula you're feeding your baby without speaking to your doctor first, as this could cause some upset for your baby. Also, if you're unsure about what kind of bottle to use, ask your pediatrician as well, as there are many bottles to choose from nowadays on the market. Remember that after you've prepared your bottle, it's only good for about an hour after you've made it. Otherwise, you need to discard it if the baby hasn't taken it within an hour. You will never ever want to microwave a bottle, because much how you microwave your own food and you get really hot and really cold spots, the same can happen with a bottle, and you can actually cause burns in your baby's mouth. Baby's formula does not need to be warm. It just doesn't need to be refrigerator cold. The ready-to-feed formula that you were using in the nursery was already room temperature. If you're trying to warm a bottle that's been in the refrigerator, you can either microwave a container of water, or you can use a bottle warmer and make sure you swirl the bottle up very much, especially if it's breast milk, because the fat will separate from the milk. And like I mentioned earlier, the bottle does not have to be warm, you just don't want it refrigerator cold. If you're nursing and you have questions about pumping, you can contact your lactation nurse, or you can refer to the sheet in your blue discharge instruction folder. For checking a baby's temperature, you want to use just a regular digital thermometer and go ahead and stick it under his arm. You're also going to have to hold his arm real firmly at his side so you make sure that you get a good reading. For babies, normal temperature range is about 98 to 100 degrees. If it's above 100.4 or below 98 degrees, that's something you need to let your doctor know about. Babies can overheat and underheat very, very quickly, so just make sure that you're dressing them appropriately in whatever you would feel comfortable in indoors, and then make sure you have them swaddled in a light blanket for about up to a month. These little guys can't quite regulate their temperature the same way that we do, so swaddling them not only keeps them comfortable, but it also helps them keep their temperature as well. If you ever suspect your baby's getting sick, you always want to make sure that you do check his temperature before you go ahead and call the pediatrician. If the babies are acting symptomatic, like refusing to eat, sleeping too much, or being excessively fussy, you can also let your doctor know about that as well. A lot of babies will do things all the time. People think they're getting sick, and it's just normal baby activity, like sneezing, getting startled very easily, quivering at the mouth. It doesn't necessarily mean that they're getting cold or they're getting sick. It's just normal newborn activity. Children are going to eventually get sick. There's nothing you can do to completely prevent that. However, all you can do as a parent is be a very good advocate. Make sure you do good hand washing before and after touching a baby, and before and after changing. Also before feeding preparations as well. Definitely let your child not be around anyone that you know is being sick, has been sick, or you suspect of being sick. Most of the pediatricians recommend that you don't bring a baby out in public for the first 6 to 8 weeks after they're born. You especially don't want to bring your child out too early during the cold and flu seasons. To go ahead and swaddle your baby, you want to take just a regular blanket, lay it down in a diamond shape on your bed, fold the top part down into a triangle. This is where her neck and her shoulders are going to meet. Hold one arm down, snugly wrap one side over, and tuck it behind her back. Tuck the bottom tail up under her back, hold the other arm down, and pull real snug. And there you have a little swaddle baby. For positioning a baby, tummy time is important, but only if they're awake. You never want to lay a sleeping baby down like this for the night. Tummy time will help her build her neck muscles up and gives her a better view of the world. And it's also a very comfortable position if a baby's been fussy. To reduce the risk of SIDS, we ask that you keep your baby lying on her back for sleep. The sleeper swaddle sack that we give you at discharge can also help with that. Okay. Here we go. To put the babies in the sleeper sack, go ahead and unzip the front. Okay. Just put it on her like you're putting on a shirt. Okay. Okay. Go ahead and zip up the front, and then you'll strap the sides. There you go. That easy. To also help reduce the risk of SIDS, you want to keep your crib free of all toys, heavy blankets, and do not use a bumper at your crib.